Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on sinusitis caused because of the odontogenic infection. So basically patient reported with the chief complaint of pain in the upper right side. He basically complained of pus discharge in the upper right side region. So upper right side region, this is 1-7 and this is 1-8. So there is history of endodontic treatment in 1-7. As you can see, this is the mesial root of 1-7, the mesiobuccal root of 1-7. Okay, so we'll just hide the lines. So we can see this is the mesiobuccal root canal, and we can also appreciate the mesiobuccal 2 MB2 root canal as we approach from the axis opening level, and as we go down we can see there is evidence of MB2 canal, which I'll be marking it over here. Okay, so there's MB2 canal and there's MB2 canal. This is the MB2 canal, which has a separate exit. You can have a look at it, separate exit when compared to the MB1 canal. And MB2 canal, when viewed in the sagittal cross section, there is the MB2 canal. Okay, and there's the MB1 canal. So maybe because of the unfilled MB2 canal there is some pathology, as well as you can also appreciate the distobuccal canal. So this is the distobuccal root canal. So we'll just arrange it along the long axis of the tooth. So we'll arrange it over here in the sagittal cross section as well as in the coronal cross section. We can see there is apical extrusion of gutta percha point. So there's a radiopaque gutta percha point, and you can also notice there is some kind of external root resorption that is caused because of the apical extrusion, as well as this is the remnant, the resorbed part of the root. So there is, since there is external root resorption, also we can see the palatal root canal. This is the palatal root. We'll arrange it along the long axis of the tooth. So as we can see, this is the palatal root. Again, there is external root resorption noted mildly compared to the distal buccal root canal, and this is the sealer, radiopaque sealer noted in the sinus. So all these factors, the missed MB2 canal and the presence of sealer as well as the presence of apical extrusion has caused such a huge infection in the sinus. So the sinusitis is so huge that the buccal cortical plate is almost lost. The buccal lateral wall of the sinus is not evident throughout. You can just have a look. So this is the lateral wall of the sinus. This is the palatal, the floor of the sinus. The lateral wall of the sinus is not visible when viewed from the anterior region and to the posterior region till the 8. So there is loss of wall of the sinus, which has caused huge infection, and hence patient is complaining of discharge of pus from the right side. And you can also appreciate the presence of wisdom tooth as noted over here. So this is the wisdom tooth. This is from the palatal aspect and this is from the buccal aspect. You can appreciate the root canal system, the 3D volume. There is definitely sealer remnant in the sinus, and the root resorption is also noted in the distobuccal canal. This is the distobuccal root canal. So this is the apical end of the root, and you can see apical extrusion noted over here. And the missed MB2 canal can be appreciated only in the grayscale images, which is seen over here. So this is the MB2 canal. Same thing, we can study it over the cross-sectional slices. So when seen in the 0.5 mm cross sections, you can see it over here. This is the MB2 canal, missed MB2 canal noted, and the walls, the buccal walls are lost. This is the furcation region, and loss of buccal cortex. There is extravasation of the sinus mucosal fluid and increased sinus mucosal lining thickening because of the presence of such a huge infection with external root resorption and apical extrusion of gutta percha. And there's a third molar, though no pathology or any caries is associated with the third molar. This could be only this could be one of the cause of such a huge infection where patient had pain and pus discharge both. Also, if you note, this is the premolar region, but premolar region, it seems to be completely asymptomatic. There is no the root canal system is entirely filled in the apical one-third region, and pain could be only because of the sinusitis that is present. Okay, so this was a case of sinusitis chronic sinusitis caused because of the odontogenic origin.